Dear students, today we are going to see about the cerebral angiography topic. So when we talk about angiography, what is angiography? It is the study of blood vessels. When we have mentioned the term cerebral, that means we are going to study about the blood vessels present in the cerebral, that is the skull. So in this session I am going to explain you what are the arteries we look in the anterior view, what we get in the posterior view, and this topic is very much important when we do the post processing in CT or MRI. So let's move on. Our angiography, when we talk about cerebral angiography, if we are including the four main vessels from arch of aorta, you can see it is well mentioned here, arch of aorta. So here we will be getting four branches. One is the right common carotid, left common carotid in the anterior view, and posterior view you can see the same level we have left vertebral and right vertebral. So together they will form the four vessel angiography, or you can say angiogram of the neck area. So if it is mentioned as four vessel, you have to mention all these views. When we go for the cerebral angiography, basically we have and we look for the arteries forming the COW, that is cow, circle of Willis. And circle of Willis is the main area where damages happen when a patient meets with a stroke. So when we go to the anterior view, we know that from the heart we have the first branch that is we get is the ascending aorta. How ascending aorta? Because we all know that largest blood vessel, that is the artery, is known as aorta. So we get the ascending aorta. So ascending aorta, in the bottom you can see two branches. We get right and left coronary artery who supplies for the cardiac, that is heart. So that way we will be seeing in the cardiac or coronary angio. Next, from arch of aorta in the mid area, that is known as aortic knuckle. Knuckle means a bend. Okay, so here we get three divisions. If we see from right to left, we get first branch, second branch and third branch immediately. So the first branch is known as, from right side, it is known as brachiocephalic artery. Next we have the left common carotid artery. The second branch is only having one branch, that is left common carotid. And the third branch is giving, that is left subclavian and left vertebral. So actually once it introduced from the arch of aorta, immediately it gives the branches. So we have three branches. First branch has three branch. One is right subclavian. It is also called, on the films you can see RSA, that is right subclavian. Next, posteriorly we get the right vertebral artery, RVA, and anteriorly it moves to the right common carotid. So first branch, laterally it is giving the right subclavian artery, posteriorly it gives the right vertebral artery, and anteriorly it gives the right common carotid artery. Similarly, we have anteriorly the second branch, it goes upward, that is left common carotid. How it will be mentioned? It will be mentioned as LCCA. You have to know the short forms, so it will be easy for you when you are making the post processing, because it is not possible for us to make all these things. Okay, next to the third branch, the left side, it immediately rises up and gives two branches. One branch moves to the lateral side, giving left subclavian artery, and posteriorly it gives you LVA. And I hope now it is clear. LVA means left vertebral artery. Okay, so we have covered the neck region. Anteriorly whom we have right common carotid and left common carotid. And what are the posterior branches coming out from the arch of aorta? They are right subvertebral and left vertebral. And laterally we have the right subclavian and left subclavian. So the first branch from the right side, before it gets three division, what it is known as? It is known as brachiocephalic artery. So questions may come. Brachiocephalic artery give branches to right subclavian, right vertebral, right common carotid. Okay. So next thing, now we will be coming, so this we have covered the neck region. So now we will go to the anterior views. We have now right common, left common, they are moving upward, and it has given two branches. One is external carotid artery, another one is internal carotid artery. So external carotid artery will be having right and left both, and they will be supplying to the orbital or facial area, and the another one which is moving upward will join as a right internal carotid artery, and it will move upward. So once it moves upward, suddenly what happened, it gets a bend, and you can see in the image, after getting bent, it is proceeding towards the midline. So these arteries are known as mid cerebral artery. So the question may be, mid cerebral artery is an extension of right internal carotid artery. So both mid cerebral artery, right and left, will join together to one artery, and they will form the anterior communicating artery. So this is all from the anterior view. Next, we will moving to the posterior side. Once we look from the back side, what we will get? We will get again the thin arteries. Who are they? Right vertebral and left vertebral. They will move upward, and in the foramen of magnum, they will get divide in the occipital area mainly, and they will form the basilar artery. Right and left vertebral artery join together to form the basilar artery. Okay, basilar area. So that is why sometimes we called zygomatic view as basilar view. Okay, next, once the basilar artery, they will move upward, again they will get bifurcate, and they will form the superior cerebral artery, and the top they are going to form the posterior cerebral artery. Okay, so one we will get, one is a superior cerebral artery, another one we will get a posterior communicating artery, and they will join with the mid cerebral, that is the part of internal carotid artery, and they will form. So this is all about the coronary angiofilming you have to give when you are doing the post processing of coronary angio. So I hope it is now clear to you, and if you have any queries, you can mention in the comment box in your classroom group. Okay, that's all. Thank you.